This is my video presentation of me preparing a patient for surgery. I currently have 5-year-old Kono laying right lateral on our treatment table. She is in for a cruciate repair today. As you can see, I have started to clip her left hind leg. I'll be making my way from her hip joint down to her hock and over her stifle and into her inner thigh as well. At this point in the video, the pulse ox that is connected to Kono's tongue has started beeping at me. I adjust the probe on her tongue and use my hand against her left side to check her heart rate and make sure that she is still stable. She's still got a tiny blink reflex. She's on 2.5. After I've completed clipping her left leg, I start the scrubbing process where I scrub to get rid of any dirt and debris that is on her leg. I'm using clean swabs in a kidney dish full of warm water and Chlorhex. I'm scrubbing from top to bottom on all of the exposed skin. I will usually scrub for a couple minutes with the Chlorhex, and this is done in preparation to moving her into the theatre where I will perform the final sterile surgery scrub. At this point in the video, Kono has already been moved into our surgical theatre. I wasn't able to film myself in this part moving her as I needed extra hands from my teammates to carry her as she's over 15 kilos. She's currently laid in dorsal recumbency where I start scrubbing her leg in preparation for surgery. Step 1, as you can see that I'm doing here, is using iodine scrub. I'm starting from the stifle, working my way outwards all around the back of the leg out to the fur. I'm still currently scrubbing Kono's skin with the iodine scrub. I do like to get a bit of a lather going with this first step, and I do like to take a couple minutes in this step as well. Step 2, which I've started here, is using methylated spirits. With this step again, like step 1, I'm starting from the stifle, working my way around the leg and outwards to the fur. I do like to drench the leg in the methylated spirits, so I do spray directly onto the leg and then use the swabs to wipe it off. In my practice, our surgical scrub does require step 1 and 2 to be repeated again. So after I've done the first initial iodine scrub and then the methylated spirits, I will then repeat these steps. I'm currently on step 3, which is our final step. This is using iodine concentrate. This again, I start from the stifle, working my way outwards. This is the final step and it does need to be completed 100% effectively. With this step, I continually swap out my swab so I'm not reusing a swab that has already cleaned the area. Cindy, who is my lovely helper today, is holding up the leg for me as no other nurses were available. She is holding up the leg purely because we don't want it to be dropping down against the surgery table or any possible towels that are underneath Kono at the moment. This is done so we are effectively sterilising her leg before Dave will then be applying drapes underneath her. So you can see here that Dave, who is our orthopaedic surgeon, is now applying the drapes. I'm still holding her leg up. He will be wrapping plain drapes all around her leg on all parts of the body to make it 100% sterile for his working space. I will be holding up the leg until he uses a small plain drape to grab the end of her foot there so he can then manoeuvre the leg as he needs during the surgery.
I'll grab the leg off you.
In this part of the video, you can view me opening autoclave packets. Most of these will have orthopaedic instruments that Dave requires for the procedure, like medium and large retractors. I open them by dropping them directly from the air onto the opened kit on the trolley.